The 2019-20 coronavirus pandemic is an ongoing global pandemic of coronavirus disease 2019 (COVID-19), caused by severe acute respiratory syndrome coronavirus 2 (SARS-CoV-2). The outbreak was first identified in Wuhan, Hubei, China, in December 2019, and was recognized as a pandemic by the World Health Organization on the 11th of March 2020. As of the 22nd of March, more than 315,000 cases of COVID-19 have been reported in over 188 countries and territories, resulting in more than 13,500 deaths and 95,000 recoveries. Severe acute respiratory syndrome coronavirus 2 (SARS-CoV-2), previously known by the provisional name 2019 novel coronavirus 2019 CoV, is a positive-sense single-stranded RNA virus. It is contagious in humans and is the cause of the ongoing pandemic of coronavirus disease 2019 (COVID-19) that has been designated a public health emergency of international concern by the World Health Organization. SARS-CoV-2 has close genetic similarity to bat coronaviruses, from which it likely originated, and intermediate animal reservoir such as a pangolin is also thought to be involved in its introduction to human. From a taxonomic perspective, SARS-CoV-2 is classified as a strain of the species severe acute respiratory syndrome-related coronavirus. The strain was first discovered in Wuhan, China, so it has sometimes been referred to as the Wuhan virus or Wuhan coronavirus. Because the World Health Organization discourages the use of names based upon locations and to avoid confusion with the disease SARS, it sometimes refers to the virus as the virus responsible for COVID-19 or the COVID-19 virus. In public health communications, both the virus and the disease are often called coronavirus by the general public, but scientists and most journalists typically use more precise terms. Human-to-human transmission of SARS-CoV-2 has been confirmed during the 2019-20 coronavirus pandemic. Transmission occurs primarily via respiratory droplets from coughs and sneezes within a range of about 2 meters (6 feet, 7 inches). Indirect contact via contaminated surfaces is another possible cause of infection. Preliminary research indicates that the virus may remain viable on plastic and steel for up to 3 days, but does not survive on cardboard for more than 1 day or on copper for more than 4 hours, and is inactivated by soap. Viral RNA has also been found in stool samples from infected patients. The first known infections from the SARS-CoV-2 strain were discovered in Wuhan, China, the original source of viral transmission to humans, and when the strain became pathogenic remains unclear. Research into the natural reservoir of the virus strain that caused the 2002-2004 SARS outbreak has resulted in the discovery of many SARS-like bat coronaviruses, most originating in the Rhinolophus genus of horseshoe bats, and 2 viral nucleic acid sequences found in samples taken from Rhinolophus cynicus show a resemblance of 80% to SARS-CoV-2. A third viral nucleic acid sequence from Rhinolophus affinis, collected in Yunnan province and designated RATG13, has a 96% resemblance to SARS-CoV-2. The World Health Organization considers bats the most likely natural reservoir of SARS-CoV-2. But differences between the bat coronavirus and SARS-CoV-2 suggest that humans were infected via an intermediate host. A metagenomic study published in 2019 previously revealed that SARS-CoV, the strain of the virus that causes SARS, was the most widely distributed coronavirus among a sample of Sunda pangolins. On the 7th of February 2020, it was announced that researchers from Guangzhou had discovered a pangolin sample with a viral nucleic acid sequence 99% identical to SARS-CoV-2. When released, the results clarified that the receptor binding domain of the S protein of the newly discovered pangolin CoV is virtually identical to that of 2019 CoV, with one amino acid difference. Pangolins are protected under Chinese law, but their poaching and trading for use in traditional Chinese medicine remains common. The virus is spread between people primarily via respiratory droplets produced during coughing. These droplets can also be produced from sneezing and normal exhalation, and these droplets can contaminate surfaces for a heretofore unknown amount of time. It is contagious when people are symptomatic, although spread may be possible before symptoms appear. The time between exposure and symptom onset is typically around 5 days, but may range from 2 to 14 days. Common symptoms include fever, cough, and shortness of breath. Complications may include pneumonia and acute respiratory distress syndrome. There is no vaccine or specific antiviral treatment. Primary treatment is symptomatic and supportive therapy. Recommended preventive measures include hand washing, covering the mouth when coughing, maintaining distance from other people, and monitoring and self-isolation for people who suspect they are infected. Efforts to prevent the virus spreading include travel restrictions, quarantines, curfews, event postponements and cancellations, and facility closures. These include a quarantine of Hubei, nationwide quarantines in Italy and elsewhere in Europe, curfew measures elsewhere in China and South Korea, various border closures or incoming passenger restrictions, screening at airports and train stations, and travel advisories regarding regions with community transmission. Schools and universities have closed either on a nationwide or local basis in over 124 countries, affecting more than 1.2 billion students. The pandemic has led to global socio-economic disruption, the postponement or cancellation of sporting and cultural events, and widespread fears of supply shortages which have spurred panic buying. Misinformation and conspiracy theories about the virus have spread online, and there have been incidents of xenophobia and racism against Chinese and other East or Southeast Asian people. Some political leaders have called the pandemic the most significant global crisis since World War II. Patient zero is the term used to describe the first ever case of a disease. There have been various theories as to where the patient zero case may have originated. The first known case of the novel coronavirus was traced back to the 1st of December 2019 in Wuhan, Hubei, China. A later unconfirmed claim, citing Chinese government documents, suggests that the first victim was a 55-year-old man who fell ill on the 17th of November 2019.
Within the next month, the number of coronavirus cases in Hubei gradually increased to a couple of hundred, before rapidly increasing in January 2020. On the 31st of December 2019, the virus had caused enough cases of unknown pneumonia to be reported to health authorities in Wuhan, the capital of Hubei province, to trigger an investigation. These were mostly linked to the Huanan seafood wholesale market, which also sold live animals. Thus the virus is thought to have a zoonotic origin.
The crude mortality ratio, reported deaths divided by reported cases, is 3 to 4%, according to the World Health Organization, as of the 6th of March 2020. The reported rate varies by country, age, and other health problems. The time from development of symptoms to death has been between 6 and 41 days, with a median of 14 days. By the 21st of March, more than 11,400 deaths had been attributed to COVID-19. Most of those who have died were elderly. About 80% of deaths were in those over 60, and 75% had pre-existing health conditions including cardiovascular diseases and diabetes. The first confirmed death was on the 9th of January 2020 in Wuhan. The first death outside China occurred on the 1st of February in the Philippines, and the first death outside Asia was in France on the 14th of February. By the 28th of February, outside mainland China, more than a dozen deaths each were recorded in Iran, South Korea, and Italy. By the 13th of March, over 40 countries and territories had reported deaths, on every continent except Antarctica.